Aloha, welcome. This is Michelle Melendez, and I am the founder of Women Being Fit. And I have an amazing privilege today of interviewing Pam Popper. She is the founder and president of Wellness Forum Health, which offers direct to consumer healthcare services and education. She serves on the Physicians Steering Committee and the President's Board for the Physicians Committee for Responsible Medicine in Washington, D.C. She has been featured in many widely distributed documentaries, including Processed People, Making a Killing, and Forks Over Knives. She is one of the co-authors of the companion book, which was on the New York Times bestseller list for 66 weeks. She's also the author of Food Over Medicine, The Conversation That Can Save Your Life. And something super incredible and unique about this amazing woman is she is a public policy expert and continually works toward changing laws that interfere with patients' right to choose their health provider and method of care. And lastly, she has testified in front of legislation committees on numerous occasions and twice in front of the USDA's Dietary Guidelines Advisory Committee. Pam, thank you so much. You're an expert among experts on health and on public policies and what can people do to keep themselves sovereign. So thank you so much for joining me today.
Well, thank you for having me. We sure do have a lot to talk about in that area.
Yes, absolutely. And let's get started. My very first question is, what were your thoughts when COVID started coming out at the beginning of this year? What were you thinking?
Well, I'll tell you kind of a funny story. First of all, I started getting phone calls. We had an event on March 7th here at our office, and it was, I think we ended up having like 80 or 90 people who came. We have a fairly large meeting room here. But the first time it showed up on my radar screen was people in the office were saying that people were calling and saying, are you guys still going to have this thing on March 7th? Well, why wouldn't we have this thing on March 7th? And then people are saying, well, what about COVID? I'm going, what about COVID? You know, it's flu season, whatever. So I thought it was really strange. We only had like a couple people who decided not to come. Everybody else came. We had a normal day. And then it wasn't long after that. It was like 3 or 4 days after that when the really scary stuff started happening, right? So just by way of a little background, my company has been in business for 25 years, and our business is informed medical decision making. And we've created these huge libraries of courses and educational programs and articles and so people all over the world, we have members in 33 countries who join to access our material. And so to a certain extent, part of my job is to check out new stuff, new drug, new procedure, a new supplement, people invent a new disease, whatever, it's my job to check it out. So the way that this actually started was I thought this was interesting, all this fuss. I didn't know what was going to happen, of course. So I thought I ought to check this out, and I'll allocate one of my then twice weekly video clips. Now I'm doing 4 a week for obvious reasons, more stuff to talk about, but I'll allocate one of my video clips to this COVID issue. And I looked into it a little bit, enough to create maybe a 10-minute video. And what it sounded or seemed like to me was it was eerily reminiscent of an episode that had happened in 2009 and 2010, when the CDC and the World Health Organization had faked a pandemic. Interestingly enough, I predicted it. Now I'll tell you what triggered my predicting it was they had started, you might remember, they started talking about swine flu, H1N1. And we were going to have, it started kind of like this did, it's going to be a bad year. And then it's going to be a really bad year. And then this started in Mexico, and we're going to have to screen everybody coming in from Mexico because people are going to be bringing it into the country. And then, oh my gosh, everybody's going to need to get vaccinated. We've had poor vaccine uptake, and so all this hysteria. And then right in the middle of all of it, the CDC and the World Health Organization sent out this interesting advisory, and it said, we're so overwhelmed with cases. Is this starting to sound familiar? That we're going to do no testing anymore. You just assume that when people show up in a nursing home or in an emergency room or urgent care or something like that, and they have a sniffle or a cold-like symptoms or a sore throat, just assume it's swine flu, H1N1. And I thought something is really wrong here, all right? Well, as it turned out, after this was all over, I had said they declared a pandemic and stopped the testing because there really wasn't a pandemic. And they were at risk of people finding that out because you can call the state and find out how many cases are reported, right? So CBS News, this was in 2010. Remember, reporters back then were curious and they investigated. So CBS News launched an investigation, and they discovered that the reason why they had made that instruction is that there was no pandemic at all. Even people coming in from Mexico didn't have the swine flu, and that's where it supposedly had originated. So people coming back from vacation, they tested everybody, nothing. So here in the United States, when you do something like that, they slap your hand and say, bad girl, you should not have lied to the public. In Europe, they were a little more strict, and there were some hearings, and Margaret Chan, who was head of the World Health Organization, she got her hand slapped a little bit, but she retired with her reputation intact, and she's a well-respected person around the world still today. And the estimate of the wasted money for this was $18 billion worldwide, and there were some pretty scathing things written about it. This was a despicable moment in public health. So this is what it looked like to me, because there were just no numbers to support it. I mean, that's something that we've all been talking about a lot. Mm-hmm. Where are the numbers that support all this stuff? So that's how it started. So I put out this video, I think it was like March 10th or something like that. And within a short period of time, I'm getting thousands of emails. And at the time, and this is really interesting, about half of them were, I think something's wrong too. People were starting to have, early on, people were starting to have suspicion. And then the other half were, oh my God, death threats and people screaming and hollering, and you're a menace to public health, and here they are trying to protect us, and blah, blah, blah. Well, the hate mails dropped a whole lot. People are not so much doing that anymore. It's almost all positive. And I'll tell you this, I just have to say this, it really validated what we do here, because since this all started in March, and here we are, we're doing this toward the end of August, we have had not 3%, three paying members who have disagreed with what I've had to say about this, because our people knew. We had trained them. Those are the people who are writing and saying, I knew something was wrong with this. This doesn't make any sense at all. So that's how it all started. And even back then, I had no idea. I mean, I knew I'd hit a chord, so make more videos, right? But oh my gosh, who would have known it would have turned into all this? And here we'd be in August still talking about this stuff, right?
And it seems like it's getting worse. It's like, I live here on the Big Island of Hawaii. We've had 0 deaths here on the Big Island, 40 in the entire state, with over 5,000 supposed cases. And and I don't know about all of them, but I know a lot of that 40 died with COVID, not of COVID, because there was cancer and different other ailments. And yet we've had lockdowns and masks, and masks are still in place, mandatory masks. You can't go into stores without them. So tell us a little bit about masks. Is there science, like the science behind masks? I'm looking at this cloth. I can't breathe. I get actually a little anxiety from it and feel like I want to throw up. So I'm wearing a shield just to go get food, the plastic thing. But what's the deal with the face masks? And that does not seem healthy. It's like, as far as a fitness, personal trainer, I'm like, you're breathing in your own oxygen. Your carbon dioxide, and it starts to get wet. Tell us a little bit about masks and why they say that they're working.
Well, for the record, I don't wear one. I've never worn one. I was in a grocery store today, and this woman said, you have to wear a mask. I said, no, I don't. And I just walked on. And generally that works, you can have a little bit of fun with this, by the way. I always make it a point to get a grocery cart from the parking lot that hasn't been sterilized. And people, you should see them in the parking lot, shock and awe, And I said, I'm trying to kill myself, just so you know. So you have to have a little fun with this. So you go,
yeah. Oh my gosh.
But to get serious about the mask issue, what I think, first of all, you're exactly right. This is a dangerous practice. And in fact, every single policy that these people, they're not health authorities. These are, and we no longer have elected officials. We have emperors and empresses and kings and queens who have taken over our life. Our government, as we knew it, has been overthrown. And unelected health officials and criminals are in charge now. Criminals are in charge. They will be criminally prosecuted if it is the last thing I do on this planet. Believe me, I have that as a goal. But they've taken over, and they've instituted policies that are designed to make us sicker. This is actually designed to sicken the public. And one of the, I don't know if you know about this, but related to the mask issue was Cuomo, the Emperor Cuomo in New York, who's had some of the strictest lockdown measures, okay? Actually did a press conference. I don't know how these people do it with a straight face. And he showed a chart showing that 66% of the hospital admissions had been people sheltering at home with no contact with the outside world. And okay, so people who did, and he said they weren't riding public transportation, they actually had no contact with the outside world, 66%. And then at the bottom of the chart, it said, stay safe, stay home. Okay, so apparently they don't see the irony in that. So really what we would have wanted to do, and it's related to the mask issue, is young and healthy people. I consider myself, I'm 63, but I'm a young and healthy person. I have no comorbidities and I don't take any drugs and I'm normal weight and all that. So what should happen is people like you and I would be out and about and we would get it, most likely contract it, but be asymptomatic and clear it. And then you end up with herd immunity. You get some people who get mildly sick, a little bit more, there's a scale of a spectrum of illness. And of course, the elderly and very vulnerable often die of it. But most of us would develop herd immunity and then we never have to worry about this again. So the staying at home, that didn't help. The wearing of masks, that didn't help. And even if there was really something going on, the mask policy is not going to help because for a mask to actually be protective, and you can, don't take my word for it, just anybody watching this, go online and look at what these people look like in a laboratory where they're working with viruses. Take a look at the hazmat suits that they're wearing. And if you think this thing that you bought on Amazon that says on the box won't protect against viruses is going to help you, it's not. And what really makes it even worse, in addition to the fact that we all just should get this and get it over with, is what you were talking about, that it gets wet and then people touch it all day long. I've noticed people coming into we don't wear masks in here, but the people coming in to change out the towels and it's a great big building here and lots of stuff going on. First of all, you can't understand a word they say, so they're pulling down the mask to talk to you.
Yeah.
Then you've got to drink water, you've got to pull it down to eat, to answer the phone, okay, because you just can't be heard. Okay, so what are you doing? If I put a mask on in the morning, I'm going to touch that thing 52 times by 2 o'clock in the afternoon. And what am I touching in between? Now, this is a clean building here. It's meticulous. You can eat off the floor in our warehouse, all right? But having said that, how many people have touched my phone? How many people came in my office and wrote something down with a pencil? This piece of paper is something I'm doing this afternoon. 16 people in my office have handled it. I go back and I get a folder, file folder of stuff. And who handled that? How many people? And how many people put their hand on the drawer? So what's happening is all that is getting close to my mouth. And the first rule you tell people during flu season is keep your hands away from your mouth, right? Well, we're specifically putting the hands by the mouth all day long. And then you see people putting it on their rear view mirror. They're using it again and again. So really the way that I feel about it, when I went to the grocery store today, I didn't wear a mask, and the risk to my health was not that I'm not masked. The risk to my health is those masked people who are walking around with a bacterial soup and their kids, and nobody can understand what anybody's saying. So they're pulling, even the store staff, if you ask where something is, they have to pull it down just so that they can be heard. So it's the worst possible policy. It's designed to make people sick. And I mean, I don't know if anybody's noticed, but here in Columbus, it's 90 degrees today. This isn't flu season. I mean, we've never had episodes of the flu during August in Columbus, Ohio. It's ridiculous.
Yes. Oh my gosh. And what blows my mind is that I saw the interview with the governor of South Dakota, and South Dakota has 11 times less morbidity than per 100,000 people than New York City. And they didn't wear masks and they're not locked down.
Right.
And it's like, let's look at those states.
There's no relationship between the policies and success. And in fact, because the news is reporting the policy line, it's all canned, you're not really getting the straight story. So if you look at what does the New York Times and what does some of the media's reports say about Sweden?
I was going to ask you about that.
Yeah, they'll say Sweden is regretting. They're reviewing everything they've done. They regret the whole 9 yards. Well, one of the things I tell people, I say this in my video clips often, because people are skeptical about what I say. I say, listen, if you're going to check out one thing, just one, okay, look at what the media says in the United States about Sweden, and then go to Sweden's actual data and see what they're saying about what happened. It's like there's no relationship. So the New York Times is saying they regret what they did. The data are awful. So many people died. And then if you look at what are the Swedes saying about it, they're saying we did a great job. They are looking at that like every country, the nursing home population was the most vulnerable. Could we do something better next time? But they're basically giving each other the high five, saying we kept our economy open for the most part. We haven't had much damage. The kids are in school. Life went on. People were pretty responsible. We didn't have to worry about it, right? So from country to country, there's no relationship between strictness of lockdown measures and masks and results. Between states, there's no relationship. In fact, the ones with the worst and most onerous regulations had the worst data, actually, is what turned out.
And where would somebody find the Swedish data? Where would they go for that?
Just Google it. You can Google Sweden's health minister, and see what he has to say. And there's an epidemiologist in Sweden. I think his name is Tegnell, Tegnell, and he's spoken out, and he has access to the data. He's actually worked with the government, and he has a lot to say too. But their data are phenomenal. And by the way, the Danes aren't wearing masks, and the Dutch aren't wearing masks. The Swiss are not wearing masks, and the Danish authorities, by the way, this is another thing that in the United States they say, oh, the Danish are so irresponsible, they're not wearing masks. The Danish health authorities are saying there's no evidence that it helps, and by the way, we have some of the lowest death rates in the world, so why are you criticizing us and the decisions that we made, right?
Absolutely, absolutely. And then what breaks my heart is the children who have the least amount of risk. We're trying to get the schools back open again, which they closed again. In our Hawaii Big Island, 0 deaths on the Big Island, 40 in the whole state supposedly. And yet the schools are wanting children to wear masks and do the social distancing and do all the plastic stuff. And what do you think about that? Children wearing masks, in my view, I think that's gonna affect that child for their entire life.
Well, schools are not safe places for children. Actually, schools were not good places for children before this. And I'll tell you that there are a lot of good things that are going to come out of this.
Yes.
As bad as it is. One of them is that about half of all people now are pulling their kids out of school. And a lot of them are being forced into doing it because they're opening and then closing again, because if some grandparent gets the flu, then you got to shut everything down. It's ridiculous. It's absolutely ridiculous. So we have built, by the way, a homeschool resource center on our Make Americans Free Again website. It's the biggest in the world. It has everything there. We have private coaches. If you want to, I tell everybody, get your child out of the school. Private schools, public schools, this is a dystopian place that your child will be recovering from the psychological damage for the rest of his life, okay?
Yes.
Get them out, and you'll be so shocked at how easy it is to homeschool, how much better it is, how much less time it takes. I mean, the misconceptions around it are that you're going to have to teach chemistry to your 10th grader at the kitchen table. That's not the way that this works at all. And a friend of mine, just to tell you how cool this gets, was originally horrified at the thought of homeschooling. And then when she saw the whole nonsense, she said, I can't send my little boy there. This is just not good. And so I saw her recently, and she said, I'm starting to really like this homeschooling thing. And I said, why? And she goes, well, I didn't realize how much we planned our whole family life around school. And she said, my husband and I want to take a trip. And normally we'd be looking at, well, we have to do it at Thanksgiving weekend, or we have to, she said, we decided to do it in the middle of September because our little boy can do school anywhere, including the family members that we're going to visit. And so she goes, I should have done this a long time ago. This is great, And so parents are starting, once they get into it and they see what's going on, they're going to get a better education, because the state's dirty little secret is the homeschool kids are doing better anyway. Mm-hmm. You get to control what they have access to, because they're getting access to a lot of stuff that parents find objectionable. And your kid doesn't have to deal with masks and social distancing. I mean, how are they going to enforce it? I want to see a first grade teacher keep little kids 6 feet apart, right?
Or with the mask on their face. Like they're constantly pulling on it. Yeah.
Ridiculous.
Yeah. And so tell me, what do you have? What is the system for homeschooling you have on your site?
Well, we started this organization called MakeAmericansFreeAgain.com. And the reason I started it is one day I had this epiphany. They're never going to let us go. They're never going to let us go.
It's getting worse.
I mean, elections can help the whole situation, but they're never going to let us go. So our emperor is never going to get in front of the camera and say, okay, it's over now, everybody go back to normal. He's going to keep doing this. And there's so many incentives for him to keep doing it, some of which I don't know that we want to talk about here, but I think he's compromised. Let me put it that way. I think that several governors either had a psychotic break on the same weekend or they're compromised. Let's put it that way. So that's not going to happen. We're going to have to free ourselves from tyranny. And there are a number of different ways to do this. Massive civil disobedience, voting these people out, lawsuits, massive lawsuits. And boy, the lawsuit action is starting to get very interesting in this country right now. So that's how we're going to free ourselves. So I started this organization, MakeAmericansFreeAgain.com. And what we're doing is we're gathering a database that can be sorted by individual legislative district. It's a massive project to do this for tens of millions of people. And you have to have money and infrastructure. And it just so happens I've got both of those things because my company is fairly big and I got a lot of people around here that can make this kind of thing happen. So we thought, well, what can we do while we're gathering up all the people that would be helpful? Well, one is this homeschool thing, because we're, for the first time, we've got millions of parents who need to homeschool their kids now, and they've never done it before. And they had we launched on July 7th, and at that time, it's like 60 days, you got to have this stuff figured out. So that's the first thing we did. Then we built a legal resource center, and we've got a couple people that are amassing all the lawsuits being filed all over the country, all of them. And they're divided by category: lawsuits against the orders, lawsuits from churches, lawsuits about masks, the whole 9 yards. And then we're going to file some ourselves. That's coming soon. So we're going to be in that realm. We have a good news section, by the way, which is just try to post something every day that's positive in terms of people advocating and getting organized and getting things done, and people who write and say, here's how I've managed to shop, without a mask for the last 2 weeks or whatever. So, and then our plan in the long term is to really get busy and take out bad politicians and make them sign a pledge. I am going to support your right to choose whether or not to get a vaccine, because we know that the end game here involves mandatory vaccination. We know that, right?
Yes.
So we have to make sure that that doesn't happen. Okay. So at the end, I have a couple of other things I want to do when we free ourselves from tyranny and all that kind of thing. I want to do two big projects. And the first one is I want to organize a corps of retired teachers to go into these economically disadvantaged areas and rescue these children who are falling behind before they close the schools and will never catch up. We're going to lose an entire generation of economically disadvantaged children, and I will finance it. We will put together, I'm committed to do this. We're going to put together a corps of retired teachers to go into these neighborhoods, and we're going to figure out, I haven't got the logistics worked out yet, but and I think the parents in these areas will help, will endorse this. These parents do not want their children to fail. And the school system has completely abandoned their responsibility. Our government has completely abandoned their responsibility. We're going to take over and do for them what public education never did for them, which is to really teach these kids how to succeed in life. That's project number one. And then project number two is we're going to organize people who are experienced in business like I am into teams. And we're going to go rescue businesses that can be rescued. There are a lot of people who close their businesses who think that they're done.
Yeah.
But if we go to them and say, look, we'll help you renegotiate your lease, all right? We'll help you get inventory. And then we figure out what we have to do. Because just take, for example, let's say that some flower shop that's closed, we get them reopened. All right, how many flowers do you have to sell in the first 6 weeks you're back to keep this place open, get back on your feet, all right? I'll send flowers to everybody in the county, and I'll do my part, all right? So you start putting the word out for people that can to spend money. And when we get to the place where we have $70 million, my gosh, if everybody just spent $10, think about what we could do to stimulate small business, right? So those are the long-term plans. But the first priority is we have to free ourselves from tyranny, and that's what we're working on right now.
So what would you say to people who are afraid? Like my friend who had a friend who was coming from Hilo's side, and he was literally on a bus coming over here, and this woman was like, you cannot take off your mask. She was a person on the bus with him. You can't take off your mask. And she was like gonna film anybody who took off their mask. And the bus driver said, yes, if you take off your mask, I have to kick you off the bus. And she literally watched everybody with her phone. So she's so much, and then when she finally got off, the bus driver's like, you guys can take your masks off. But what do you say to these people who are terrified like this? Neighbors calling in their neighbors who are like, oh, they're supposed to be in quarantine. No. It's like, oh my gosh.
I have a little bit different perspective on this than a lot of people. Okay, and I'll apologize in advance if I offend anybody, but I said I was going to wait till I was 70 years old to become a curmudgeon, and I just never made it that far. So I'm just going to tell you what I think. Back when Hitler started his antics in Germany, he could not have done what he did without a lot of willing co-conspirators in the German public.
Yes.
And it was a very similar thing. They claimed to not know what was going on or to be inspired by him. And ignorance is not a defense. If you don't know that it's illegal to kill somebody, you don't get a free pass, right? So I call these people the sing louder crowd, and I'll tell you why I use that term. There's a very famous audio. Listened to it when I was at the Holocaust Museum in Washington, D.C., and you can listen to it online. If you just put in Germany sing louder, you'll be able to hear this. And it's a German couple who talked about going to church on Sunday. In the back of the church, there was a railroad track, and the Germans were taking the Jews on trains, and you could hear them screaming in the trains. And their answer was to sing louder. Sing louder, because then you don't have to hear it. Okay? So these people are not scared. They're stupid. I'm going to say it. They're stupid. All right? I had a little more tolerance for them back in the beginning when we didn't know entirely what was going on. But our emperor gets on television in Ohio, his press conferences, and he acknowledges that he's got people knocking on doors in neighborhoods to gin up these cases. He tests positive and negative on the same day and picks the negative test because that lets him go on and live his life. And when you're the emperor, you can do that. You don't have to abide by the rules that you make for everybody else. And then locks things down and just closes the restaurants at 10 o'clock. He's destroying life in this state for everybody, all right? So anybody who's watching that and believes that we're having a pandemic, this is no longer fear. This is stupidity on a massive scale. And these people, because they're stupid, have become co-conspirators with the emperors and the empresses and the health departments, and they are equally responsible for the carnage, which is going to be bigger than the Holocaust.
Yes.
Okay? And I'll apologize in advance if I'm going to offend anybody with this, but I just say what I have to say. 11 million people, not accounting the military, were slaughtered by the Germans and the other despots that were involved. It's going to be worse when you take into consideration the nursing home deaths, the people who died from lack of care, the suicides, the overdoses. You've got doctors sounding the alarm. In so many counties, there are more suicides and overdoses than there are even cases, let alone deaths, right?
Yeah.
If you're helping with this, you masked little coward hiding in the basement, claiming fear, you're helping this. And so when they want to film me, I tell them, let's get a selfie, okay? Let me give you my name and my address so that you can send somebody to my house. Who are you going to call?
Mm-hmm.
Make my day, all right? And if more of us act like this, they're cowards. They're terrified. If they're terrified, I can make them scared of me, all right? Mm-hmm. I've had it with these people. There is no excuse for this. There is no excuse for this level of stupidity. And I'm going to come back to what schools, all right? How did these people get this way? Mm-hmm. Public education.
Yeah.
Public education, which has dumbed them down to the place where they can't critically think. And it's one of the things that had to be in place in order to pull this off. You had to have enough stupid people to buy the story that you could pull this off. So I have no patience for them anymore. I had a lot more understanding and compassion a few months ago, but I don't know how, even the fake news that's being reported, I don't know how you turn this into a pandemic. And if you don't have those critical thinking skills, I'm sorry for you, but I have no sympathy for you, and you are guilty.
Absolutely. I totally 100% agree with that. New York, I want to play the devil's advocate. If somebody's saying, but all the deaths in New York, because like this, I posted stuff on Facebook and somebody said, I said, okay, I'm from Santa Cruz, California. 7 people have died with COVID, not of COVID, of the 1,200 cases. And so I post that, and so somebody goes, thank God we're not like New York. And I'm like, so what do you have to say about New York and the cases there?
Well, I think the first thing is that Andrew Cuomo I think he should be criminally indicted, because some of what he did was unforgivable. He sent people who were COVID positive back into the nursing homes. But you can't, there's another part of this whole New York thing, and it goes to investigating, and I have firsthand accounts, affidavits in my office, okay? If you look into this, what they say happened didn't happen, all right? So let's look at what the story was. The hospitals are overrun. People are in parking lots in tents, okay? So just like every place else, New York closed most of its hospitals, okay? Mm-hmm. So the first thing I would say is, if you've got people in tents and parking lots, why aren't you opening the hospital 3 miles away that's equipped for patients? You had a boat. Trump put a boat in New York Harbor with 1,000 beds. The most people on that boat was 79. Why didn't you put them on a hospital boat? They took the Javits Center. They spent hundreds of millions of dollars building these temporary hospitals. They were never full. Yeah. So either they deliberately killed them by putting them in parking lots and tents instead of taking them to the appropriate facilities, or they lied about that going on. And I have good reason to believe that they lied for the most part about it going on, because I have firsthand accounts of people who say, I live 3 blocks from that hospital that so-and-so talked about. There were several hospitals involved in this. I rode my bike by there every day. That never happened. And that happened in a lot of areas that were considered hotspots, by the way, where people in the neighborhood actually took pictures. They say the hospital tents are full. Here's a picture. I managed to sneak in there one morning and take it, and here it is empty. All beds empty. So here's I guess what I would say about all of this. Part of the job of public health is to collect data, because data allows you to make good decisions the next time something happens, all right? The public health departments did nothing to collect good data on this. We don't know who has it because the tests are fake. We don't know who died of it because the death certificates were forged. And we have no idea about hospital utilization because we were lied to every day about it. And we're still being lied to. I just, the sheriff of Warren County in Ohio did an interview in which he disagrees with this and thinks it's all crap. And some of these people are actually calling the hospitals. He happens to be in a county that our emperor has deemed orange, which is high alert. You have 10 people in the hospital and mostly empty beds. Why is it orange? Because DeWine's throwing darts we think that DeWine has a map of the state of Ohio in his basement. He's throwing darts at it in the evening and saying, wherever the dart hits, that's going to be a red county tomorrow. I mean, there's just no justification for it whatsoever.
So why this? Like, why now? I know it's like it's for the vaccines, but why are they doing this to people? Because I remember back when I had no idea what the government was really about and what was happening in the real world. I couldn't believe it. It's like I had a boyfriend and he was like, Michelle, you got to watch this, and I was like, no, you're crazy. I was one of those people. And when I started researching, first I cried my eyes out.
Find out that we're being ruled by criminals, and we have been for a long time, and that the government's goal has always been to take over our lives. And remember, in this country, one of our major parties almost nominated a communist who loves Chairman Mao and Fidel Castro as their candidate for president. Think about that for a minute, okay? It's almost, you just can't even possibly imagine. Again, how did that happen? Decades of public education turning out idiots, all right? Because these are people who don't even understand history. Yeah. They're no different than they may have fancy degrees, but they're no different than the masked people hiding in the basement, claiming that they're afraid. Okay, they're just pathetic. But anyway, there are a lot of reasons why this is happening. I mentioned, I think one of them is that some of these governors are compromised. And the reason I say that is because a bunch of them that appeared to be despots, but at least reasonable despots, just turned into psychotic criminals over a weekend. So you either have to say that a bunch of governors had a psychotic break on the same day, which is statistically impossible, or something else happened. I think that they're compromised, and I think you know what that means, all right?
Yes.
Other people are controlling them. I think that what you're seeing with some of the emperors, like the Empress Whitmer, who's just turned into an evil person. She looks like an evil person.
And what is she, a governor of? Michigan.
Yeah, she's the Empress of Michigan right now. The Emperor of California, Newsom, yeah. Emperor Inslee in Washington State. These are people who, I think what you're watching is something called the Lucifer effect. There's a book written called The Lucifer Effect by a guy by the name of Phil Zimbardo, and he made a name for himself when he got interested in how good people turn bad. And he did a very famous experiment at Stanford University, the prison experiment. They took a vacant building and they built a mock prison, and they psychologically tested young men who were students. They all then picked healthy people. Half were going to be prisoners, half were guards. They asked them, by the way, if they had a preference, and they all said, no, we just want to do the experiment. So it wasn't like some people said, yeah, let me be a guard, right? So anyway, they did a formal arrest on a Sunday. The guards went out and arrested the prisoners and brought them in, and the guards had a meeting about how they were going to run the prison. And the original, if you read his book, the original guidelines were pretty good. I mean, we're going to keep the prisoners safe and keep them from fighting with each other and make sure they're fed and all that. Within 3 days, Zimbardo's girlfriend had stopped by, And it had degenerated to the place where somebody was going to get killed. It devolved into such a mess. The prisoners were fighting with each other, and the guards had become cruel. And so what happens when some people, even good people, get too much power, they often turn bad. And Zimbardo has been a witness in several famous trials. The most one that people would know about was the Abu Ghraib trial, what happened in Iraq, I think it was. And he said that when you create an environment like this, you can expect that this will happen every time. And if you ever choose to do it again, you get the same result. So what I'm talking about here is Gavin Newsom and Jay Inslee. These are people who overreacted and imposed a lot of draconian measures. Mm-hmm. And then at a certain point in time, this is completely disconnected from public health. Now they're just getting their jollies out of torturing people. And they are. They like being in control. They like being the emperor. And so what you're seeing is happened in Ohio, it happened in California, it happened in New York. There's been many, many states. The health directors are resigning without any comment whatsoever. A bunch of them within the last month. And I think the reason that they're doing it is that in the beginning, they may have gone along with it, but they're starting to realize now this doesn't have anything to do with health. And if I keep doing this, I'm going to lose my license. And if I have my way, they'll lose their license anyway. I'm not kidding. I look at these people the way that some people looked at Nazis, and I will hunt them down and see that they're punished for what they do. And I'm not the only person who thinks that, and I'm the least powerful person who thinks that, by the way. So these people are going to have serious problems at some point in time. But they're resigning because I think they know that they've crossed the line into criminal activity for which they'll be liable and quite possibly could lose their medical license.
So what blows my mind is these health commissions who you said are leaving. Why aren't they blowing the whistle? Why aren't they saying something?
The problem with speaking the truth is that you get vilified, and the reason is that nobody wants to come to the table and have a discussion. So think about the very brave doctors who went to Washington D.C., America's frontline doctors. So what happens as soon as they do that? They take their video down. Simone Gold gets fired for doing it because when you speak up, they threaten to take people's license away if they prescribe hydroxychloroquine. I mean, that's what happens. They vilify you. And I have to say, one of a very person I respect very much who has been affiliated with our company, Wellness Form Health, for many, many years, David Calderwood, a family practice doctor in Alabama. I've always said if I had a health issue, he's one of the few doctors in the country I would go see because I trust him. He joined that group. He went to Washington. And he did it knowing that he could even lose his medical license because he's a principled person. He was willing to do it. Well, how many people are willing to take that risk? That's the problem, okay? I mean, there's a handful out there that basically say, I'm willing to do it because I know it's the right thing to do and I'm going to let the chips fall where they may. I'm willing to do it. I mean, I get death threats and I get people calling me names but notice it's all name calling and that kind of stuff. It's not anybody saying, listen, I did what you said. I went and looked at that Swedish data and I kind of see it differently. Looks like their death rate was really high. That's not the discussion they're having. The discussion they're having is you're not sticking with the party line. Therefore, you're bad, and we're going to punish you. We'll take down your videos. We'll censor you. I don't have a medical license, but we'll take away your medical license. We'll make life so miserable, and then that sets an example for everybody else. I don't want that to happen to me.
Yeah, I see that for sure. And yeah, like me, and also just being a regular person, not having medical license, but speaking your truth. Being defriended, having friends call you crazy, like I can't speak about this with certain family members. And so, but I hear you, and now's the time to be brave. So Pam, what is it that we can do that would move us toward freedom the quickest? Because we only have a short amount of time before this is not going away unless, like you said, we make it go away.
Yeah. There are three things. There are only three things. We're not going to reason with them because they're criminals, okay? And people say, well, we just have to get evidence on it. Just think about it this way. Do you think if a group of important people in the world sent Hitler a letter and said, apparently you don't know, but a lot of Jewish people have made incredible contributions to art and music and science and literature, medicine, right? Do you think that Hitler would have read the letter and said, I had no idea, we're going to let them go? But I mean, we're closing the death camps. You cannot reason with people like this. So there are three things that we can do. And it requires the massive mobilization of huge numbers of people. That's very crucial to understanding this. Massive civil disobedience, massive, okay? Me not wearing a mask when I go to the grocery store, it's a form of civil disobedience, but 70 million people not wearing a mask tomorrow, that's a different thing. Massive protests. I'm talking about like what happened in Berlin, where 1,300,000 people, okay? 1,000 people should protest, that's all great, but they're sitting inside laughing about it, all right? We have to have massive lawsuits upon lawsuits upon lawsuits, and they have to be targeted. We've spent a lot of time looking at some of the lawsuits that have been lost and why. We're working on targeting the lawsuits a little bit differently, all right? Looking at legal angles that are more effective. And then voting these people out so that we can get people in, because one of the things we have to start looking at to keep this from happening again, we're going to have to define what is a health emergency, who has the power to do this, what kind of check and balance are we going to have, because we certainly can't leave ourselves vulnerable to the next time. They had too much fun with this. So that's basically what we're doing, by the way. We have the resources and the infrastructure to gather up 70 million people and sort them by area. And also to do the kinds of things like I've said, let's think about it. 70 million people in one day send a letter to Target, paper letter. We're not shopping there until you take out the mask mandate. They don't care about a letter from me. They don't care about a letter from you. They sure do care about 70 million people. It's over. They'll start putting pressure on the government. Think about 70 million people calling the cell phone companies and saying, if you don't take that COVID thing off my phone, I'm canceling my service. It'd be gone in a nanosecond, all right? So that's what we have to do. And I want to be really clear about this. So we're not trying to take people away from other organizations. In fact, if you go to our website, Make Americans Free Again, there's no donor button. We don't want your money, okay? What we want is your name. We need numbers. And I can't tell people I represent millions of people if I don't actually represent them. It's an integrity thing for me. So stay a member of the groups that you're with, continue to give them your money. And I tell people, if you like what we're doing, buy something from my company. But other than that, you give your money to your groups and then give us your name. And if we amass that database fast enough, we're going to be able to solve this problem. The faster we do it, the more ready we are to solve it. And that's what has to be done. It is only by mobilizing that type of number of people that we're going to free ourselves from this.
I love it. I love it. Okay, cool. And so say that website again.
MakeAmericansFreeAgain.com.
MakeAmericansFreeAgain.com. So if you're watching this, please go there. Pam, is there anything else that you want to share as far as what to understand this virus? Because I'm just thinking about my mom. And I love you, Mom, if you're watching this. And her roots, my mother's she doesn't go out with her roots not be. Her roots are this long because she's afraid to go to the salon because she's in her 60s and she's afraid of this virus. Is there anything that you want to tell people who are like that?
Well, I think the first thing is that the government is responsible for making people afraid about nothing, and that was their goal. But here's the thing, the flu comes every year. And when we had the swine flu, we actually did have 57 million cases worldwide. Well, I think what do we have here? 5, right? So we're only 52 million cases away from something that happened in 2009. We didn't shut anything down. So go live your life, enjoy your life, forget about this, okay? And here's the thing, just look at it with driving, okay? What if you applied the same principle to driving? People get in accidents, they do.
Yeah.
People die in accidents. The response to that, based on how we act to this, don't drive ever until we come up with a way where there's no way you'll have an accident. We have to have 0 accidents and 0 deaths from driving, or you just shouldn't drive. Well, nobody in their right mind would agree with that. But it's only through very careful messaging and brainwashing that people have agreed with this. But it's the same thing. You cannot live a risk-free life. It's not worth living, actually.
Yeah, that's true.
Okay. I mean, I do everything right in terms of driving, but if I get hit by a bus on the way home, I can't help that. And I also can't live a productive or enjoyable life worrying about it all day long. Okay. Yes. The roof could fall on my head. An earthquake could swallow the building. Okay, I mean, there's no end to the number of things, bad things that could happen. And if you spend your life worrying about it and trying to avoid all risk, I don't know anybody who wants to live like that. And you certainly can't live like that indefinitely, because eventually it's not going to, the problem isn't going to be that your roots are all grown out. The problem is going to be that you have nothing to live for. Yeah. And we cannot let the despots do this. That's what they want to do. They want to turn you into a ward of the state who has nothing to look forward to except what the state is willing to give to you. I don't want to live that way. I don't think anybody wants to live that way if they really would stop and think about it.
Yeah.
So, and I'll say this too. I had some pretty harsh things to say about scared people and the snitches and all that kind of stuff. We're going to save you too, in spite of yourself, all right? Because it's the right thing to do. And you can't help it if you're stupid, perhaps, but we're going to save you anyway. And then at some point in time, we're going to have to figure out some way of re-educating these people, not in a forceful taking over their lives kind of way, but so that they aren't hurt by the next time that this happens, you know?
Yeah.
So this is more things to figure out once we get ourselves free.
Yeah, lots of systems breaking down, lots of things changing. And for those of you also who are afraid, just understand that the media is owned by the corporations who sell vaccines. They have an agenda for the propaganda that they are sharing. So go and, you know, learn from Pam, learn from people like her. And Pam, thank you so much for joining.
I just want to add one thing.
Yes, please.
I think with all this going on, we have to end on a happy note. Okay. So here's the happy note. Before this happened in February, I went through a phase. I've gone through so many phases. I went through a phase where I was like kind of reminiscing about February. I wish we could go back to February. And then I realized I don't want to go back to February because that's when the environment was right for this to happen. And we don't ever want to go back there. So what was going on in February that allowed this? Public education was collapsing. We talked about reform for decades. Did you ever see any reform? I didn't see any reform. The medical system was careening toward increasing incompetence. Look what happened with the opiate epidemic. We learned nothing. Doctors prescribed drugs because pretty girls who used to be cheerleaders in high school told them there was an epidemic of untreated pain and oxy was not addictive. Can we have a medical system that functions that way? Careening toward disaster. We had a government that was reaching into our lives and taking control, right? And we had a media that had become a mouthpiece, as you just said, for drug companies and government. Okay, so let's look at how the world could be. They talk about a new normal. I don't like their new normal.
No.
The new normal is public education that the public wants. We design it. Because we say as a people, our kids aren't going back to school until you change school, because we're pretty happy homeschooling, so we can never go back, and that's okay if that's the way it is. We remake the medical system and get rid of the excess and the god-awful things that were happening. I spent 25 years of my life writing and talking about it. We remake a medical system that works for everybody. We rein in the government, and we work really hard to make sure this never happens again.
Yes.
And we really, the media is rendering itself useless. And more people are saying, I don't even watch television anymore. That's the best thing that ever happened in the world is people not watching television anymore, right? So I think that out of this, in about 10 years, you and I are going to have a conversation like this. And we're going to say, remember when that happened? I mean, it's hard to believe, painful as all get out, but necessary, because look at where we ended up. And it could not have happened unless you just blew it up and then built it again.
Yes.
So that's the happy news, is that I think out of this is going to come something wonderful.
I totally agree with that. It's like a diamond that has pressure in the rock. You cannot create diamonds without that pressure.
Right.
And
Exactly.
that's what's happening in these systems. I would like to actually do one more interview with you around the system so we can actually talk about what's actually happening, because when I learned that information, it blew my mind and opened my mind to what was really happening. And those systems, they need to break down because their time has come. Right. And we are moving toward a more freer society, a more happier society, and a more abundant society than we've ever can possibly imagine. And Those people who are out of work right now, what would you say? What advice would you give them, people who have lost their jobs with this?
Well, sometimes I'll just share personal experience. But out of the worst possible things that have happened in my life, I'm 63, I've been around for a while, have come the most fabulous things that I never would have even known to look for had I not had the disastrous thing happen.
Yeah.
And so, there are two ways that you can look at everything. You can look at it's all lost, it's all screwed up, we'll never, or you can say there's a reason for this, and I'm going to find out where it is I'm supposed to be. Now, I don't want to be dismissive about the devastation because it's horrific. It's horrific.
Very.
But I will promise this: we get out from under the tyranny. I know I will, and I know a whole lot of other people, because we're all meeting each other. You and I would never have had this conversation if it wasn't for this. So we just have new friends, right? And I think a lot of people like you and I, and there are millions of it, who are ready to dig in and help.
Yes.
Right? And we got to get ourselves free the moment. I mean, we got to take care of the issue at hand, and then we're going to help you people out there who have been devastated. And not relying on government. What the heck has the government ever done that helped anybody? Get them the heck out of the way. Let some business people come in. There will be new companies and new jobs. I mean, my company's hired people. We grew during this. And by the way, I think that's an important point to point out. I've always kept myself out of personal self-interest in the things I talk about. If this went on for another year, it'd be better for me. I'm advocating against my own financial interest to try and end this, because that's how important it is. All right. But having said that, we hired new people. There will be other companies hiring new people.
Yes.
There will be opportunities. So try to stay positive, try to stay sane, stay connected. I mean, the reason I'm sane is because I come to work every day and I'm around people who think the same way, and I'm talking to people like you. So you got to get connected to your tribe. We are your tribe.
Yes. Absolutely. I love that. And also, I just want to share that if you're watching this and you're struggling and you don't have a job right now, there is something inside you. There's a greater power inside of you that's beating your heart right now. That same infinite intelligence put the planets in orbit. That same infinite intelligence is running the tides in the ocean. There's a reason why you're here at this time in history. There's a reason, and honor that. Follow your internal guidance, and you will be guided to the next job that you probably love way more than the other one you had before anyway. So this is a breakdown for a breakthrough toward freedom. And Pam, thank you so much for your insights, your information, all of the work that you've done to help America be free again. And give that website one more time, and then we're going to write it down on below.
All right, makeamericansfreeagain.com.
Makeamericansfreeagain.com. That is happening. I see it already done. I see a world where we are free again and living more joyous, abundant lives for everyone, more health. That is happening. And Pam, you are a huge part of it. Such a pleasure to meet you and such a pleasure to interview you. Thank you so much. Much mahalo.
Thank you.
All right. Aloha, everyone. I'll see you on the next interview.